Hello everyone. Today I'm going to present your tutorial on facial nerve, that is your seventh cranial nerve. Facial nerve is the seventh cranial nerve. We have 12 cranial nerves, out of which the seventh cranial nerve is your facial nerve. It is a mixed, that is both motor and sensory nerve. It supplies all the muscles of facial expression. That's why it is known as facial nerve. It is the most frequently paralyzed nerve of all the peripheral nerves of the body. Okay, so we are going to discuss its functional components and nuclei, its cores and its branches in part 1 of this tutorial. Then we would discuss its clinical anatomy in a separate video. Okay, so we are going to discuss the functional component and nuclei of the facial nerve, right? So, first of all, what is a nuclei? Nuclei is basically a cluster of neurons that is present in the brain stem and they have similar connections and functions, right? So, what is happening here is that axons which carry information to the CNS and from the CNS, they first forms a synapse at these nuclei, right? Okay, so there are four functional components: special visceral efferent, general visceral efferent, special visceral afferent, general somatic afferent. Right. Okay, so let's understand what is special visceral efferent first. Special visceral efferent are the nerve fibers that innervates the voluntary striated muscles of larynx, pharynx, muscles of facial expression and muscles of mastication. So here we are concerned with muscles of facial expression, right? So let's see. Basically, they arise from the motor nucleus of the facial nerve. Right, so they are arising from the motor nucleus of the facial nerve. Where? In the pons. What are they supplying? They supply the muscles of facial expression. Right. Okay. So, next we have general visceral efferent. So general visceral efferent, these are efferent fibers of the brainstem that projects through cranial nerves, right? So these are preganglionic parasympathetic fibers. Preganglionic means what? Nerve fibers that run from the CNS to the ganglion. Right. So these are parasympathetic fibers which arise from the lacrimatory and superior salivatory nucleus in the brain stem. So these are arising from the lacrimatory and superior salivatory nuclei, and they supply secretomotor fibers to lacrimal, submandibular and sublingual glands. So what is meant by secretomotor? Secretomotor fiber means basically these fibers induce a gland to release its secretions. It means they induce lacrimal gland to release tears and submandibular and sublingual glands to release saliva, right? So they are supplying secretomotor fibers to these glands. Then we have special visceral afferent. So special visceral afferent are afferent fibers which carry special senses of smell and taste. So here we are concerned with the taste. From where? Taste from anterior two-third of the tongue except the valid papillae. So we learnt in the nerve supply of the tongue that from taste from the anterior two-third is carried by the chorda tympani nerve, right? Chorda tympani nerve of the facial nerve. So here the taste from anterior two-third of the tongue except valid papillae, right? These are carried by the special visceral afferent fibers. Then we have general somatic afferent. General somatic afferent are fibers which carry general sensations like your touch, pain and temperature. So here they carry general sensations from the skin of the auricle and terminate in the spinal nucleus of the trigeminal nerve, right? So they are basically carrying the general sensations from the skin of the auricle, your pinna, right? Pinna. Okay, so we learnt about the four functional components, and we learnt about the nuclei. So we have the motor nucleus of the facial nerve. Basically, facial nerve is predominantly although it's a mixed nerve, but it is predominantly a motor nerve because it supplies muscles of facial expression, right? And its motor nucleus is quite large and quite big. So it is predominantly a motor nerve. Although it's a mixed nerve, but it is predominantly a motor nerve. So we have motor nucleus of the facial nerve. Then we saw the lacrimatory and superior salivatory nucleus, right? And then here we have tractus solitarius, which is carrying taste from anterior two-third of the tongue. Tractus solitarius, right? And then we saw that the general somatic afferent fibers terminate in the spinal nucleus of the trigeminal nerve, right? So this is all about the functional component and nuclei of the facial nerve. Okay, so we are going to discuss its course and its branches in this slide, and then we would later discuss its branches in detail in the next slide, right? So facial nerve arises from the pontomedullary junction. It has two roots, motor root and a sensory root. Motor root is larger and it is present medially, and sensory root is present laterally and it is smaller in comparison to the motor root. After emerging from the brain stem, it enters the internal acoustic meatus. Right, so this is your internal acoustic meatus. Internal acoustic meatus is a 1 centimeter long opening in petrous part of the temporal bone. So it is a 1 centimeter long opening in the petrous part of the temporal bone. Within the temporal bone only, after entering the internal acoustic meatus, within the temporal bone only, it leaves the internal acoustic meatus and enters the Z-shaped facial nerve. So here lies your Z-shaped facial nerve, right? Facial canal, sorry. It is your Z-shaped facial canal. After entering the facial canal, that is Z shaped, it follows three important events, right? It follows three important events. First, the motor root and the sensory root of the facial nerve joins together, right? The motor root and the sensory root of the facial nerve fuses. Second, it forms a geniculate ganglion. So here is your geniculate ganglion, right? After forming the geniculate ganglion, it gives three branches: greater petrosal nerve, nerve to stapedius, and chorda tympani nerve, right? It gave three branches. So it arises from the pontomedullary junction. It gives two roots, motor root and sensory root. Then it enters the internal acoustic meatus, which is a 1 centimeter long opening in the petrous part of the temporal bone. Then it enters the facial canal. In facial canal, it forms geniculate ganglion. It gives three branches: greater petrosal nerve, nerve to stapedius, and chorda tympani nerve. Right. So now after supplying these, it exits the stylomastoid foramen. As it exits the stylomastoid foramen, its cranial course is also completed. Right. So its cranial course is now completed. Then it gives three branches: nerve to digastric. It is giving three branches: nerve to digastric, nerve to stylohyoid, and posterior auricular branch. And after these, it ends by giving five terminal branches in front of the auricle, that is temporal, zygomatic, buccal, mandibular, and cervical. I hope this is clear to you. Okay, so coming to its first branch, the first branch of facial nerve is greater petrosal nerve. Greater petrosal nerve arises from the geniculate ganglion. Geniculate ganglion is a sensory ganglion of facial nerve. It contains cell bodies of fibers that is responsible for conducting taste. Right. So it is basically it is basically a collection of cell bodies that is consisting the fibers that is responsible for conducting taste sensation from the anterior two-third of the tongue. Right. It consists of preganglionic parasympathetic fibers. So, what is meant by preganglionic? Preganglionic means the nerve that is running from your central nervous system to a ganglion. Parasympathetic means which is modulating your viscera, your internal organs, your blood vessels, and your glands, right? Which relay in the pterygopalatine ganglion. Pterygopalatine ganglion. Pterygopalatine is your ganglion that is present in your pterygopalatine fossa, right? And supply the secretomotor fibers to the lacrimal gland, mucous gland of nasal cavity, and palate. So, what is secretomotor fibers? Secretomotor means the capacity of the nerve fibers to induce a gland to secrete something. So basically the secretomotor fibers of the lacrimal gland, mucous glands of nasal cavity and palate induces the lacrimal gland to release tears, mucous glands to release mucus. Right. Then we have nerve to stapedius. This is the second branch of the facial nerve. It is supplying the smallest muscle of the body, right? It is the smallest skeletal muscle of the body. Then third we have chorda tympani nerve. Chorda tympani nerve consists of two type of fibers: preganglionic parasympathetic fibers, which provide secretomotor supply to the submandibular and sublingual glands. It means it is initiating submandibular and sublingual glands to release saliva, right? Then it consists of special visceral afferent fibers which carry taste sensations from anterior two-third of the tongue. So we have already learnt in the nerve supply of the tongue that taste sensations from anterior two-third of the tongue is carried by chorda tympani branch of the facial nerve. Right. Then we have posterior auricular nerve. This is your fourth branch. It supplies the occipital belly of the occipitofrontalis muscle. Then we have nerve to the posterior belly of digastric, which supplies the muscle with the same name, that is posterior belly of digastric. Then we have nerve to stylohyoid, which supply the stylohyoid muscle. Then we have five terminal branches, which is temporal, zygomatic, buccal, marginal, mandibular, and cervical. The temporal branch supplies auricularis anterior, auricularis superior, intrinsic muscles of lateral side of ear, frontalis, and corrugator supercilii. I repeat, temporal branch of facial nerve supplies auricularis anterior, auricularis superior, intrinsic muscles of lateral side of ear, frontalis, and corrugator supercilii, right? The zygomatic branch supplies orbicularis oculi. The buccal has two branches, upper and lower. Marginal branch supplies muscles of lower lip and chin. Right. Sorry, this is a common branch. Marginal mandibular. The name of the branch is marginal mandibular. Marginal mandibular supplies muscles of the lower lip and chin. Then we have cervical branch. Cervical branch supplies the platysma. Right. Okay, so we'll discuss the clinical anatomy in part 2 of this video, in which we'll discuss the Bell's palsy, the lesions of the facial nerve at different levels, and your crocodile tear syndrome, right? So till then, guys, like, share and subscribe, and you can ask your queries in the comment section below. And thank you, and please don't forget to like, share and subscribe. Thank you.